How to use a nasal spray. Most people use a nasal spray by grabbing the nasal spray, put it in their nose, squeeze it, sniff in. The medicine seems to go down the back of the throat. It doesn't taste very good, gags, and doesn't seem to have a lot of effect. And that's because instead of putting it where it needs to go, the medicine is being directed into the nasal septum, which is a thin piece of tissue which divides the nose into two cavities and acts as a funnel or a slide, putting the medicine down the back of the throat. A better way to use a nasal spray is to grab your nasal spray, put it in the opposite nostril, point to the outside of the eye, squeeze it, and sniff in. Change sides, put it on the opposite nostril, point to the outside of the eye, squeeze it, and sniff in. By doing in this manner, you're directing the medicine into the nasal turbinates, which is on the outside of the nostril, and the paranasal sinuses, which is usually the area of most congestion, and you'll get a maximal benefit. Additionally, if using a nasal spray at nighttime, the best time to use it is immediately before bedtime. By that, I mean the last thing you do. Go take a shower, put your jammies on, brush your teeth, grab your nasal spray off your nightstand, and then use it. Then what you're going to do is you're going to be laying your head back, and that's going to give you maximum saturation into the areas of concern. If you'll start using a nasal spray in this manner, I suspect you'll see a greater improvement in response to treatment.